All right, we've started. We're live. Hi, this is Mike Balzer from All Things 3D. Chris isn't here because he's probably off in the hills somewhere doing something nature-like. That's what he likes to do on these long weekends. So it'll be just me. And today we're interviewing Dr. Dan Copp, a local dentist who uses a lot of high-tech stuff, including some 3D technology, which is why I'm interviewing, obviously. So before we get started, I'd like to ask Dan his name, which obviously is Dan Copp. Let's see if he can get his name right as well. So, Dan, your name, where do you reside, and what do you do for a living?
So my name is Dan Copp. Here in San Luis Obispo, California, and I am a dentist.
Any special type of dentistry,
So
or
I'm a general dentist.
okay?
So we do.
Um,
Yeah,
Go
go
ahead.
ahead.
No, you go ahead.
I was going to say so I'm a general dentist. The vast majority of what we do in our office and what I do is what we would call restorative dentistry. Um, so crowns, fillings, restoring implants, and then a lot of cosmetic stuff as well. So.
Okay. So how does 3D 3D dentistry fit into dentistry? What kind of practical applications? Can you kind of go through some of the things that you're working with, and then I'll get into some further questions a little bit.
Yeah, because it's one of those things where it seems like about every month there's some sort of new sort of application for 3D printing that gets used in dentistry. Um, yeah, especially considering how much we do is involving custom-made things and involving things where we have to capture what's there and make something fit to what's there. So it's very appropriate. So the unquestionably the most common is for things like crowns and bridges, where you can scan the tooth intraorally and then digitally design a crown, digitally design a bridge, and then print out the crown or the bridge itself, and cement it in. But that's that's been slowly sort of evolving, where that's definitely still the most common thing. More recently, now you can, if say an implant is someone needs an implant, you can start with uh, 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 basically a CT scan, so where you have a 3D image of the bone and everything underneath there, digitally plan where exactly the implant is going to go into the bone, and off of that scan, digitally design the crown that's going to go over it, and have that all sort of adjusted with how the teeth are going to fit together, how you're going to have it look, how it's going to function, all that before any surgery has ever been done. Because then once you have that designed, you can print out an actual surgical template to then guide the implant surgery, so that the surgeon just goes right in and knows exactly where to go. Um,
Yeah, that kind of segues me into my second question, is that when I was in there actually getting some work done for myself, I'd say 2 or 3 months ago I had some x-rays done, and I noticed that you had a digital back, and I think a lot of dentists, in
mhm,
fact, in radiology in general, you're going to digital backs because you don't have to deal with film anymore.
mhm,
But as we talked before, I've also worked with DICOM images,
mhm.
and especially CT scans. And I've noticed when I do some volume renderings that the jawbone is really accurate. And so I'm thinking, as you just mentioned or alluded to, that's the next step, is to actually do CT scans. Um, I'm assuming as an adjunct service, or would they have to go to the radiology, or are these getting smaller and you can actually have one in your office?
Yeah,
Um, is that the case?
yeah,
They're smaller now,
yeah.
or?
They've tweaked them now so that they have what's technically be called a cone beam scanner. It's a slight variant of it, but it's a small enough machine that a number of, even just in San Luis Obispo here, a number of in particular the oral surgeons that place a lot of implants, have them so that they have that 3D scan of where everything is before they go in. But then it's also being used by endodontists who just do root canals, so then they can see everything underneath there to see if there's anything else going on that they can't see on a standard film. But yeah,
Mhm.
they've gotten to be small enough that you could just have one in your office and don't even have to send anyone out to go do it.
Now that probably reduces the cost. And speaking of cost, let's talk about the CT scanner right now, and then we can get into the iTero system and talk about that a little bit. But how much would a CT scanner like this cost? As you said, a cone based
The
CT
cone
scanner.
beam. The newest ones, I think, I'm not 100% sure on this, but I think they're in the 100 to 150,000 range. They've come down quite a bit though. It's still pretty expensive, so it's definitely not something that everyone just has laying around.
No,
For
but
our
that's
office,
that's
we
still
don't. Yeah.
substantially less than what CT scan. Obviously,
Oh
they're going to
yeah.
be smaller, but normally they're half a million to $2 million.
Yeah.
Um, so yes, that is a
It's
good.
it's way
Yeah.
cheaper.
Yeah.
And I'm not 100% sure on that. I haven't looked in a while.
Okay. One of the things that a lot of people, and I'm just going to say it's a myth. A lot of people think that CT scanning is a horrendous amount of X-ray radiation, and from what I have been reading, that's not necessarily the case, especially with the newer versions that are out there
Hmm.
now. They have, in fact, sometimes less radiation than your older X-ray machines. Have you found that to be the case too, especially with the more
Oh yeah.
modern machines?
Yeah, it's come down pretty dramatically. Um, and it's certainly something that there's that cumulative effect with radiation. So we're pretty diligent about maintaining that and or not maintaining it, but minimizing it as much as absolutely possible. But the one of the nice things about those cone beams is that you don't have to do the whole head. So you can pick a tiny little area and just scan that area. And that's one of the changes that they made with that made it really cut down um, on how much radiation you need. Add to that the sensitivity of those digital scanners, and they're way more sensitive than any of the traditional films, and so you can use that to then cut down on on how much radiation you're using pretty dramatically there too. So it
Yeah.
ends up being a pretty solid reduction in how much radiation that you have to use.
Yeah, and as you mentioned, it has a lot to do with the receiving end or the imager is extremely sensitive,
Hmm.
plus the algorithms and the digital processing now that really helps to improve the noise level, and which is one of the big reasons why you had a higher intensity of radiation is because the amount of noise that was dispelled in the actual imaging device, and all of that has changed with technology today, which benefits us. Sad for us older people who have had to be dosed with large radiation.
Hmm.
But there's a benefit to that. You don't have to worry about having a light on when it's time to read at night,
Hmm. Yeah,
or
because you glow.
stumbling. Yeah, stumbling in the yard. You've always got a night light.
Yeah,
All right.
works
Well,
out
let's
really
move
well.
on. Yeah, let's move on to some safer radiation, and that's standard light,
Hmm.
or in this case, either ultraviolet or infrared, with the iTero intraoral scanning system, which is more of a topical or surface scanning. Um, I have a little surprise for you. If you remember a couple of weeks ago, I came in there and you actually scanned my teeth.
Hmm.
And so while you're talking about it, I'm going to be playing it in the background.
Oh,
So
perfect.
you'll enjoy that. So, uh, so can you see it? Can you see yourself?
Yep.
Yeah. So why don't you kind of talk about the whole process and the piece of equipment for a few minutes, and then we'll go right into what happened. Obviously, you sent me some scans. So kind of talk about what's going on right now.
And this is one of those things where there are now several different companies that do make intraoral scanners like this. This particular one, the one that we use is the iTero.
Is there a
And
benefit to the iTero system?
um, yeah, there's because well, when we bought it, it was a lot easier to use, in my opinion, than a lot of the other ones out there, and you could do more with it because it actually had open architecture with the file type that it created. In the last couple of years, though, some of that's changed where there are now a couple other machines that do pretty similar things. So it's gotten certainly a lot more competitive in that sense. So the way it works then is we dry the tooth off, which you can see the assistant doing right there, and it's basically just bouncing light, almost like sonar, but with light, where it's just bouncing light off of it, and then you can see on the screen off to my right there, you can see where it slowly is stitching together all those different images to then create the 3D image. And generally, the way we kind of use it is more than anything else for things like crowns or something that's going to go over the tooth. So we would take lots of scans from several different angles to capture every single sort of micron of that tooth, and then generally just about two scans of all the other teeth to get a 3D image of everything else. And then the lab, as they're creating the crown, can see the tooth right next door, and they can see all the other teeth on that side, and then also see how the teeth actually fit together and how everything bites down, so they can design the proper bite and get the contact and the functionality right as well, without with really pretty minimal adjustment that we ever end up having to do once it's actually back inside your mouth. So then after we create this digital scan, one of a couple different things can happen, because we'll have a 3D digital model of whatever preparation on the tooth we've done, and then all the adjacent teeth, and again all the opposing teeth of how it bites down. So with that 3D model, we can either have the lab just digitally design the crown, inlay, onlay, whatever it is, or bridge, or whatever it is that we're making. And if it's porcelain, basically mill that out, print that out, and not necessarily ever actually have a physical model. And then the whole thing is completely CAD/CAM digital and works really pretty well. The other way that we do it pretty frequently is also using this to then just print out the actual model itself. So then the lab will get the printed model of what the tooth looks like, the adjacent teeth, and it's a more accurate, sort of easier for them to use model than what we would traditionally do is take the basically goopy impression, send that, they pour stone in it, and then depending on what we're doing with it, kind of go from there.
Now you say they're printing these. What are they
Yeah.
printing it with?
Well, it's a in terms of the specific printer, that I don't know, but it's a polycarbonate material, and it's a reductive printer though, so it's milling it down.
Okay, so it's taking a block of something
Yeah,
and
exactly.
taking away from it. Is additive printing being used? I mean, that's one of the things we're going to be
Yeah,
experimenting with. Uh, so it is being used.
absolutely.
Is it in
There's
my case?
stereo, because some of the companies use stereolithography models, and I think some of the other ones are doing a couple other type of thing too, for mainly for the models themselves more than anything else.
Okay. Yeah, it would make sense. However, we're going to do something a little different, and that is part of the reasons we did this. And like you said, it's not normally the case. You took some scans using the iTero system, and then you sent me the actual digital file, and then you kind of left it up with me. And I'm thinking to myself, now, what am I doing? I must be nuts. Here I am designing my own cavity that they're going to put into my tooth. Do I really want to do this? What if it doesn't fit right? So obviously I'm taking a lot longer designing this than I have with other things because it's going in my mouth.
Hmm.
I guess I shouldn't really say that. I'm spending more time because I'm selfish, but
Yeah,
but
I know what you mean. Well, and that's the other thing that we're going to ultimately end up doing. Because of all that, and because we have to also be 100% sure about how that fits, is we're going to have the model. Well, it's already been printed out, so that we can take the resin that you print out that's going to get invested and cast into a gold alloy. We're going to take that resin and be able to try it in on the model to be 100% sure, and then have a certified lab technician look at that and tweak it a little bit if we need to, and kind of go from there.
okay. Well, I'm assuming whatever I print out, they can file away or
Yeah,
add
exactly.
to,
That's
they can
kind of what
use
I'm
it as a,
counting on.
okay. Yeah. Yeah, otherwise
No
I don't.
offense.
Sorry, Mr. Balzer, it doesn't fit in your mouth. You're just going to have to go around with pain for the rest of your life.
Yeah,
And the
exactly.
sad thing is, as you mentioned, Dan, I have a temporary in there now, and I'm noticing a little more pain each day. So it's like the
Just a little
clock is ticking.
sensitivity.
Yeah,
Yeah,
a little
because the
pressure
fit,
pain.
yeah, the fit on the temporaries is never quite as perfect as we'd like it, and so that's also a big part of why some of the other companies that are out there that make these type of dental specific products have also a porcelain mill that's attached to them, where then you do the scans pretty similar to that, and then just as basically it would be in your case, it would be as you're still sitting there, we design that and hit print and it mills it out of a block of porcelain. You don't ever have a temporary at all. And those work pretty well as well. It's sort of a lengthy process to do while you're sitting there. So we just have the lab do it for us, but it does
When
work
you
pretty
say
well.
when you say lengthy, what is lengthy?
So it ends up being about 15, 20 minutes to do all the scans and then the design, and then another about another 15, 20 minutes to actually mill it out, depending on the size of what you're milling. The bigger it is, the more sort of intricate details in there, the longer it takes. And then it's another 20 minutes because then once it gets printed out, and this also depends on what material you're using, but then another 20 minutes to actually fire that yeah, and then stain and glaze it and things like that.
And so it sounds like about an hour,
Mm-hmm.
hour and a half.
Mm-hmm.
Okay, so I don't know if how much you're familiar with SLA printing, but an hour and a half is probably the really low end of most printing that's done on it. So,
Yeah.
um,
Long time just to be sitting in the chair waiting for us to do this is more what I meant.
yeah, well, I can imagine, but as far as milling versus SLA, I don't see the real advantage unless you get into much more intricate shapes. For instance, if you
Yeah.
remember, we did the full scan almost a year ago. Gosh, it's been almost that long, of my mouth,
Mm-hmm.
and that took 8 hours to print that out. So
Oh,
obviously
I didn't realize that.
somebody's not going to sit in their chair for that long. So
Yeah, I hope
now,
not.
yeah, now again, this is well, I guess you would call prosumer or the low end of the commercial market. We're
Mm-hmm.
talking $3,500, $4,000 SLA printer. Obviously, they have some much more expensive ones, 20,000 up. That in fact, there's a defunct version. I can't think that has been used a lot in dental. That's I think close to I want to say $50 to $100,000, which I don't know if it's substantially faster, but because of the process where they use galvanometers and lasers, it's a very slow process, and I don't see it improving any time in the lower end. But that may another be an advantage why you don't see a lot of it now. Plus, the materials, at least on this end, are poisonous or toxic. And however, I did find one, and I think there's a you can get some durable materials, but I think there's some toxicity to them. But the less durable materials, I just found one that's not FDA approved, which would also, excuse me, have to be done. It isn't poisonous, so you could
Mm.
use it in your
Could
mouth.
actually use it.
Correct. But I don't think it's that durable, so how long would it
Mm-hmm.
last, until somebody chomps down on something?
Mm-hmm.
So I think there's a long way to go to bring down the cost of that for, the
Absolutely.
standard dentist, but I'm thinking maybe larger shops may go into it. So in my own experience, the next thing I'm going to jump into is, I have been tinkering around with this, and pretty much this is what I was working with before, Dan, so I'm going to show it here. But I'm using a off-the-shelf 3D application called Mesh Mixer, which literally costs nothing, made by a company, Autodesk, who is very familiar in the CAD CAM market with their larger, more expensive products. But they've introduced a series of 3D applications for the novice. This actually has a lot of robust tools for doing what they call mesh design
Mm-hmm.
and manipulation. So you can rotate it like a lot of the other tools. But essentially what I did prior to this is, let's see if I can just cause this. There we go. So there we have a filling that I have formed into the tube. But essentially what I did was create a block of material and put the tooth in it and then essentially subtract it. So it came out with this positive filling. But the problem is it fit the conforms of the tooth itself, which left a gap. So what I have done since then is kind of smoothed it out. Also, it didn't have some surface area that I had to fill in because it was only filling in the depression. So I actually had to use some tools. You have some sculpting tools here and some brushes. So essentially I can drag, draw. In my case, I use the inflate tool, and I'll demonstrate. And you can modify the size and the strength by these slides, and depending on, let's see, we'll turn it on its side here so you can see it. But if you notice, it's inflating it. So
Mm-hmm.
essentially I can add material, and if I increase the strength or increase the size of the tool, more of the area raises. So,
Yeah.
okay. So essentially, I went around the whole tool, the tooth itself, or the cavity, the filling, and raised it to a level that I felt was comfortable. Then went around the edges and used the smoothing tools. This has the ability to undo. So if you didn't like what you're doing, you can go back and move it all. And there's multi-levels of undo in it. The other tools that I used extensively, let's get back to skull, was the bubble smooth, the shrink smooth, and the smoothing tools, which allows you to give a smooth texture to it, and it literally reduces it. So the way these organic programs work is they use what they call subdivision, where they improve the mesh. They increase the resolution of the mesh itself so that you can work with it. So it appears like you're literally working with clay. And one of the big programs in this industry has been what they call ZBrush, which has been it's about an $800 program, which has a lot of these tools. So it's interesting that you can move for it. The nice thing about this application is that it's made for 3D printing. So I could literally, if I wanted to, click on highlight this, which I've done, and say 3D print, and we'll go ahead and do that. And it will bring up a 3D tool in a matter of minutes. Hopefully it'll stay on this screen here. There we go. And it's brought it onto the MakerBot replicator. Actually, it brought in both forms, but you can see it. So if I wanted to, right now, I can change its orientation. Can I with this one? Here we go. So I can change its orientation. And then said OK. And then I can add support material, so it would build supports underneath it. And then I could send it out to the printer and print it. Problem is, most consumer or prosumer FDM printers only print 100 microns. Well, that means you have ridges, and you've already seen some of the prints that I've done with my teeth, and obviously they wouldn't get. So I wouldn't actually go to the MakerBot or one of my other prosumer or even a commercial. They just don't have the resolution. I would go to an SLA, which I can on one of them get down to 25 microns, which you said is satisfactory, but I have another printer that should be able to get down to 15 microns once it's finely tuned. Even better, obviously, because the smoother and more detail, the more accurate the actual casting will be. So,
especially since the other big part of what we're trying to do is keep bacteria out.
Okay, so it has to form a good seal, is what I'm understanding. Okay, so essentially,
there'll be cement in there to fill in that. There's a gap no matter what, so there's cement that gets in there, and that's what really creates that final seal. But the tighter that is, still the better. And that was the big problem with a lot of the initial early generations of the dental 3D scanners and printers, is that accuracy was not there, and it's the newer generations are leaps and bounds better.
Okay, so how long has 3D been actually involved in dentistry? Obviously, I've only
the earliest that I am aware of is by a company called Sirona and their product Cerac. And I want to say 25-ish years, 25 years. They've been doing it for a long time.
Okay. Well, that would make sense.
And the software that they create actually works pretty similar to this, where you can kind of push and pull the design, and then it also gives you a readout of how much contact you have with the tooth in front of it or with the tooth that it's going to be biting down and hitting on. So then you can tweak that to kind of however you like it.
Well, one of the things that I was meaning to ask you in one of the previous conversations is there's two different types of modeling that you might or may not be familiar with. One is mesh modeling, where you literally have a bunch of vertices or triangles or quadrant that you might be working polygons, as they call them, and you're actually moving these vertices around. And we talked about subdivision, which is increasing the number of vertices so that you have, it's like working with Photoshop. The more pixels you have, the more resolution and the higher definition the image appears. If you start zooming in on it, you start seeing some pixelation or blockiness. The other type is what they call solid modeling, where you essentially convert the curves and faces into a mathematical model. So that way, anytime that you manipulate it, you're literally manipulating the numbers. You're not manipulating the vertices. And then
Hmm.
that's converted. Do you know when you talk about how close it is to the other tooth, what type of technique? Because that sounds a lot like solid modeling, where you can actually look at friction coefficients
Hmm.
and pressures. Do you know if they're converting a mesh into a solid model?
That'd be my guess. I'm not 100% sure on that though.
Okay. Uh,
Especially since a lot of those companies are pretty tight-lipped on their proprietary software and what they specifically are doing. Especially as more and more companies kind of come into market with it, then it's just getting more and more competitive. So that I'm not sure about. I'd have to look into it.
okay, so I'm going to move on into another application that I'm working with. Let's get into this is NetFab, and this is the go-to application for a lot of professionals to work with that allow you to take any type of mesh and test it and then use either some built-in, what would you call them, automatic cleanup tools and correction tools, or you can finally adjust a lot of things. I think for those people who are novices, probably rely a lot more on the auto tools, and they actually have built certain parts of their algorithms into a lot of the 3D print slicers, as they call them, the software that runs the 3D printer. So what I've done is I've taken that and brought it into here. Now, one of the things, and let's see if I've actually have it there. We talked about looking at the byte process. So luckily, if I left the its location in space as I imported them, they appeared to be from whatever you align them to,
Mhm.
according to the byte. So
Yeah,
it
because
does
we
look
took that
fairly
secondary there, that additional scan from the side to show how your teeth actually fit together.
right. And I am assuming the iTero software had the ability of putting these in relative space. So if I left the positioning alone and then brought them in, it worked great. The problem is I then had to take the cavity, or excuse me, the filling, and put it accurately in the location, which is not hard. It's like filling a slot. So the next step that I'm going to do is subtract this upper layer here. Oops, I guess I'm not even showing it. This upper layer here, so I apologize again. So to recap, this is a product called NetFab, and I have the lower, oops, this is upside down, the
Hmm.
upper, there we go. Yeah, spin it right. There we go. The upper and the lower portion. Let's see, I guess it's that way. And the actual filling or cavity portion is up here. So if I,
They're still upside down.
there we go.
Yeah,
Jeez. That's why you're the dentist and I'm not. Okay, so I'll cause the
there you go.
accident there. So you can see here where the filling portion actually lays on the tooth itself, and I can highlight that. So if you notice, it actually goes into the tooth below. Well, the idea is that we don't want that. So what I'm going to do now that I know the bite is relative, is subtract this tooth from this filling, and that will make it conform directly to the bite itself. Um, the
Yeah,
only
because like we
problem,
talked about with this particular one, there's only those specific points of contact that we want. And the other sort of rub, so to speak, that we haven't even gotten into is, and it's one of the sort of deficiencies currently that we have with it, even though there's definitely people that are working on it. But for example, with this, and it's the same for most all the other softwares that I've dental software that I've used with it. It just gives you that static position, but realistically, when you're chewing, that's not necessarily exactly where you are, and you're going through more of this chewing motion, and so that we still don't have a great way of testing out digitally, and able to and really simulating that movement, and that's something that often we have to um, fine tune once we actually get it in there. We can get it pretty close digitally, but it's you end up guessing a little bit if that's what you're trying to do, and that plays a huge role too in everything and the stability of the teeth and the bite and all that.
that would be interesting. there's a product called SolidWorks. You may have heard of it. It specializes in the ability of creating models and then running physics upon them so that you can
Mhm.
actually look at the different forces and you can cause particular parts to move in a particular manner. So it would be interesting to see something like that being applied here, where you turn these into
Yeah.
solid portions and then run algorithms on it.
Yeah,
So
because there's
maybe
definitely a
that's,
couple companies like because I've seen sort of prototype versions of it. I've never seen a true sort of working version of it. Um, and I haven't, to be honest, I haven't checked on it in a while. But last I heard, none of them work quite right.
yeah, it probably still takes, it's all algorithms and they
Mhm.
don't, you know,
Well,
they
for a
can get
couple of
close.
years, yeah, it's been one of those things that for a couple of years I've been hearing, oh, next month we'll have it all up and running. Just give us one more month. So we'll see. It's tremendously complicated. It's not like it's not an easy task to accomplish. So
Yeah, well, if they can simulate other things like sending things to Mars, I think that they'll get there. It depends on the amount of money.
I think they'll figure it out.
Yeah, maybe if NASA gets behind it. No. Okay, so getting back to, so we're pretty close here, and as I mentioned, I'm going to subtract that, and then I'll have something that I'll be able to print. Now, obviously, I could either reduce this in software, but I probably won't touch it anymore, and then I will send it off to the lab. They'll put this in the model and see how close I am. If I'm really off, they'll give me the grade of F, and then they'll say, go back to what you're normally doing and stay out of our business. Or if I'm successful, we'll be able to put it in my mouth, and I can proudly say I designed my own filling. But it was a long journey. I leave that to you. You know, it's kind of nice talking to people who are doing other things other than 3D printing or electronics or IT or programming, who are applying these tools. It kind of, you know, it's one thing hearing about it, it's another thing actually working in this specialty, because one, there's a whole another language involved with it, but two, you really determine the person's skills by these other things. I would have to say you're an excellent craftsman in dentistry, you know,
Thank you. I appreciate that.
and you know, I think more people should respect, you know, not saying they don't, surgeons and doctors who have these specialties, because you know they're fantastic. Okay, enough patting you on the back. Let's move on to the. So once I get done with this, I'll send it off, and then you know my final question, and then you can go back to having a nice holiday. Is, you know, I remember back in my past, back when I was a kid, they used to give out lollipops and things like that. But I've noticed that's kind of gone away. Now they give
I
out
can't imagine
stickers.
why.
You know, did you ever feel like when you were going through dentistry school, I don't know, you're still young, but you were probably a kid. Did you kind of wonder why did they do that? Was that just to get them back in there in the chair, or was it just they didn't really understand? I don't know. But you
Well, to
know,
be honest, I I have not experienced that, so I'm not 100% sure, but I would bet, given the kind of what specific research has come out in terms of especially figuring out what actually causes things like gum disease and cavities in the last 15, 20 years, it's probably a combination of wanting to, uh, especially with little kids, make them happy and give them some positive ending to God,
a
especially
traumatic experience.
a real positive experience. Um, so I think it was more just not necessarily knowing.
Yeah. Well, even us big guys, big little guys, I don't know
Hmm.
what you got. We still get our toys. You give out little
Hmm.
chapsticks, and
Yeah. Well,
so
see, you just got to look a little lower. All the toys and everything are actually directly below the chapstick. You just got to look a
what?
little lower. You just missed it. You got too focused
Jesus.
on the chapstick.
Well, I guess I
I'll
was
set out
happy
a
with it.
I'll set out a big basket of Snickers for you next time. How about that? Rub it
Oh
on there.
yeah,
Yeah.
yeah. Good gracious. Come
It'll be
on
really,
back.
yeah, right. Well, that'll get you back pretty soon. If you just leave it on there.
Yeah.
Yeah.
I'll come up with something. Make a mold
Yeah.
of something and put it on my. I don't know what happened to my teeth
Yeah.
today.
They're
I
black
don't know
now.
what this stuff, this
Yeah.
black stuff is. Okay. Well, thank you, Dan. I really
Oh, my
appreciate you
pleasure.
coming on, and
Interesting
yeah,
stuff, huh?
Yeah, it is extremely interesting. As mentioned, learn a lot from talking to a lot of different people. I'm actually going to have a radiologist on tomorrow from Florida who's going to talk about his YouTube videos that really kind of explain the whole process. And I think, with all the 3D stuff that's going on right now, the actual technology needed in order to provide the digital imagery and the digital data is kind of being pushed under the table, and I'd like to make sure that it's recognized. Without CT and MRI scanning, a lot of what you're seeing out there wouldn't be possible. So it'd be
Oh
kind
yeah,
of nice to see
absolutely.
that. So he's actually going to be on tomorrow at 11. His name is Dr. Kiljoen, and he's from St. Augustine, Florida.
Hmm.
So again, thank you, Dan, for coming
My pleasure.
and being on our show. And again, this is All Things 3D and our interview with Dr. Dan Copp. And that's a wrap.